Hi, my name is Jacqueline Gerbe, and for my final project, I'm going to talk about patient falls. The aim of my change project is to reduce the number of falls on my unit by 50% by increasing communication techniques among team members over the course of 6 months. According to the Joint Commission, one of the most common contributing factors to falls with injury is communication failures. Why do we want to decrease the number of patient falls? Falls have a deep impact on everybody involved, including patients, family members, staff, and the organization. The impact on patients may include increased morbidity, increased length of stay, decreased quality of life, and decreased satisfaction. After a fall, patients may also require rehab services. Patient falls can not only have a physical effect, but also a mental effect on patients. This may result in a psychological fear of falling, which hinders their everyday lives. For family members, a fall can create a lack of trust with staff and the facility. They may be fearful to leave the patient alone, leading to their own increased stress and fatigue. For the organization, it creates a poor public image. According to the Center of Medicaid and Medicare Services, falls are a hospital-acquired condition, meaning that hospitals do not get compensated for treatment when a patient experiences a fall. For staff, they may express feelings of sadness, disappointment, and stress after a patient fall. Nurses also often feel responsible due to this being a nursing-sensitive indicator. Falls can range from minor falls without injury to serious falls that are devastating and life-altering to the patient. Individuals have a 10 to 15% decrease in life expectancy and a decline in quality of life after a hip fracture. Evidence from the literature indicates that interventions aimed towards increasing communication and decreasing patient falls include bedside report, falls wheels, and hourly rounding. A falls wheel is a visual communication tool of a patient's fall injury risk for all healthcare team members placed on every patient door. This is used to increase communication among all team members and categorize patients based on their fall and injury risks. It also contains interventions tailored to those risks. For instance, a patient will be considered a high fall risk due to altered mobility, an altered mental status, or a history of falls. They may be considered a high injury risk due to risk for bleeding or risk for fractures. This tool is meant to be updated every shift or if there is a change in a patient's fall risk assessment so that it is up to date. In a study of 2015, the use of fall wheels reduced falls with harm by 48%. Bedside report is another intervention used to reduce patient falls. This leads to an increase in nurse-to-nurse communication and allows for both the oncoming and offgoing nurse to visualize and assess the patient together while including the patient in the plan of care. It gives the opportunity to assess the patient and the environment for fall risks and identify any changes in status that may lead to falls. A 2018 study found that patient falls decreased by 24% with the implementation of bedside report. Hourly rounding can also be used to decrease patient falls. This leads to an increase in nurse-to-patient communication. Hourly rounding includes assessing pain level, need for toileting or eliminating, assessing of the environment including room temperature, proximity of personal items, safety hazards, and positioning of the patient. A year-long study in 2015 found that implementation of proactive hourly rounding decreased falls by 57.7%. The PDSA model for implementing change will be used to decrease the number of patient falls on my unit. PDSA stands for Plan, Do, Study, and Act. It allows for the quick testing of changes on a small scale. Through observations, more changes can be made where needed, and then the test can be repeated. The PDSA for my change will include the plan outlined to decrease falls. The cycle will start with a small group of nurses who are willing to participate on my unit, and as modifications are made to improve the plan, the group size will increase to unit-wide. This will hopefully extend to other units in the hospital and eventually become hospital-wide. The expected outcome for this project is to reduce the number of patient falls by 50% within 6 months. The reason for this change is that my unit had the third most falls out of any unit in the hospital for the period of January to June 2018, with 17 falls. Comparatively, the unit that experienced the most falls was the ED, with 20 falls during that time period. 4 other units had only 1 fall, 3 units had 2 falls, and the rest had between 5 and 15 falls between that time period. On my unit, which is an oncology and neurology unit, most patients are a fall risk, and the nurse-to-patient ratio is between 1 to 5 and 1 to 6. The implementation of this change will include an interdisciplinary approach requiring collaboration with physical therapy to assess fall risk and improve patient strength and stability, collaboration with nursing assistants to complete hourly rounding, and collaboration with nurses to increase compliance with bedside report. It will also require an elected member of the unit to join the Falls Committee to attend monthly Falls meeting to address what is working and what is not working on each unit. Data will be reviewed by each member of the Falls Committee to evaluate how implemented change is working on each unit. They will also be responsible for educating staff on the unit of the findings for the previous month. Compliance will also be monitored for hourly rounds. A chart will hang in each patient's room, and nurses and nursing assistants can sign their initials for each hourly round completed. Looking forward, before implementing my change project, my unit had 5 falls on the unit in the month of August. My unit had the second highest number of falls hospital-wide for that month. Through implementation of PDSA cycles, my unit should see improvements monthly on the number of falls. There should be an increase in hourly rounding, contributing to a decrease in falls, as well as an increase in patient satisfaction. Falls wheels should also result in positive communication, especially between the nurse and nursing assistants. Future PDSA models may work towards improving compliance in fall wheels being updated every shift or when a patient experiences a change in condition. They may also aim to improve compliance with bedside reporting and hourly rounding. In order to evaluate the success of this change, data must be collected over the period of 6 months to determine the effectiveness of interventions. The Falls Committee will also continue to monitor data monthly and work towards instituting interventions hospital-wide. Thank you for listening. That concludes my final project.